Guys, today we are going to discuss 5 marks questions on August 2014 previous question paper.
Okay, let's start from first question.
The first 5-mark question is contrast bath.
Contrast bath therapy is that the hot water causes vasodilation of the blood flow in the limb or body, followed by the cold water, which causes vasoconstriction, increasing local blood circulation. Additionally, the lymph vessels contract when exposed to cold, and relax in response to heat. The lymph system, unlike the circulatory system, lacks a central pump. By alternating hot and cold, it is believed that lymph vessels dilate and contract to pump and move stagnant fluid out of the injured area, and that this positively affects the inflammation process, which is the body's primary mechanism for healing damaged tissue. Contrast bathing can be used to reduce swelling around injuries or to aid recovery from exercise. It can also significantly improve muscle recovery following exercise by reducing the levels of blood lactate concentration. For any injury presenting with palpable swelling and heat, and visible redness, such as a strain, sprain, contrast baths are contraindicated during the acute inflammation stage. Acute inflammation begins at the time of injury and lasts for approximately 72 hours.
The next question is hanging. Total body is suspended by grasping a horizontal bar with the hand. Movements: shoulder flexed, adducted and medially rotated. Elbow is extended. Fingers flexed and grasping the rod. Muscle works: adductor and medial rotators of the shoulder work strongly. Flexors of elbow carry more weight and also strain. Finger flexors work strongly and grasping the bar. Adductors of hip keep it in adducted posture. Plantar flexors keep the ankle in plantar flexed position. Trunk, knee and remaining muscles of the hip is free from the work and movement.
Uses in exercise therapy. To perform total body swinging movements. To perform upper limb strengthening and body building exercises. To perform stretching exercises. Examples: mostly helpful in gymnastic activities, bar exercises.
The third question is types of muscle contraction. Muscle activity increases the intramuscular tension and changes in the muscle length. The muscle fibers are contracted and relaxed during the muscle work. We can categorize these muscle works by the change in the length and tone of the muscles into 3 varieties: isotonic contraction, isometric contraction and isokinetic contraction. In isotonic contraction, by changing the length of the muscle, the same amount of tension is created throughout the contraction is said to be isotonic contraction. There are 2 types of isotonic contractions: concentric contraction and eccentric contraction.
In isometric contraction, there is no changes in the length of the muscle but the tension. Intramuscular tension is created without changing the length of the muscle. In isokinetic contractions, the velocity, speed is same and the resistance is variable. This type of contraction and the exercise can be done with the help of the special equipment such as Biodex, Cybex, Orthron, Kincom.
Guys, today we have completed 3 5-mark questions. See you tomorrow.